Stress and anxiety are normal feelings that sometimes get out of control. As a financial advisor, you may not always know how to help. Here, two financial therapists discuss how mental health professionals can be valuable assets in assisting advisors, their staff, and clients.
For financial advisors who are wanting, or at least feel that maybe there is a client that may need more help than what they're able to provide as a financial advisor, one of the things that you can do for those clients that are struggling right now, if they're in your office, they're crying, they're talking about not being able to sleep, perhaps that are very, very angry or very, very scared, ask if you can call a family member or ask if you can call a trusted friend for them. And then you would explain to that family member or trusted friend that, you're very worried about your client and that you believe seeking out a mental health professional would be something that would be of value to the client. If for any reason you ask the client, hey, would it be okay if I call a friend for you? And they say, no, I'm okay. I really don't want you to do that. This is just normal stuff. And you know that it's not normal. Go ahead and ask then if you can follow up. Just let that person know, hey, I care about you. Can I check in with you in a few days and just see how it's going? And feel free then again at that point in time to ask again, is there someone I can call for you? And, we can do this together. We're in this together. What you're feeling is normal. I want you to know that what you're feeling is normal. I have felt those things too. The other thing is this piece of making it normal. So no matter what you say or what they tell you, it really needs to be this reiteration over and over and over again that it's normal to feel these things. It's normal to be upset during this time. It's so normal, in fact, that as a part of all the recommendations that we're making for COVID-19, we are suggesting to all of our clients that they talk to a mental health professional. So that then if you say it in that way, it's not that you're singling out that particular person, although you may be, but you've now made it a bigger deal to where we're making this recommendation across the board. We know that from the 2008 to 2010 crash that so many people suffered PTSD, fatigue, emotional stress and distress. Another particular area where you can go is the financial therapist. There are financial therapists that exist. There is a financial therapy association. So if you want to work with someone as a financial advisor, you want to find a financial therapist as a person that could be an alliance to you and your clients. There are people out there, myself included, that have practiced and continue to practice as financial therapists. They actually specialize in the things that are going on with money and its sort of interface with psychology.
I think this opportunity to normalize the stress and anxiety provides the perfect vehicle to make the referral, explaining that you're seeing clients experiencing stress and anxiety and have developed referral sources to aid them. But I think there's some other steps that can really aid in your referral. The first is that although the stigma around mental health has been decreasing every year, I think certain cultures hold some more stigma than others. And you as a person may still have stigmas around mental health. And if you hold that belief or that worry about making a referral, it'll shine through to your clients. And so it's important for you to get comfortable before you make any referrals. Maybe it'll be helpful for you to talk to someone with all the stress and anxiety you're feeling, or you could watch YouTube videos and see what therapy looks like in the real world, because I promise it doesn't look like the movie's depictions. And once you get more and more comfortable, you can learn different names of different therapy approaches and use websites like Psychology Today to learn what mental health professionals are in your town, what are their style or approach to doing therapy, even what insurance they take to make the right referral for your clients, and hopefully aid you to make some connections that could be long-lasting referral source for you.
So when you see clients in distress, our financial therapists suggest that you ask if you can call a family member or friend to help them, or if they are reluctant, ask if you can follow up to see how they are doing. Above all, make it normal to have these feelings. Then get comfortable with mental health and therapy so you can make a referral if the need arises. Some references for referrals are the Financial Therapy Association or Psychology Today. Finally, you can find lots of resources on YouTube to help you get familiar with what therapy looks like. These things will allow you to be more at ease when confronted with this situation and be able to refer just like you would when suggesting an accountant or estate planner.